There are various myths associated with extraction of the upper teeth. Let's debunk all of these myths. I am Dr. Shreya Krishna, your trusted oral surgeon from New Delhi. So whenever the upper tooth is being extracted, there will always be family, friends and relatives telling you that if you get your upper tooth extracted, you might end up with loss of vision or blurring of vision. While this might have been true many decades ago, it stands less than 0.01% of a chance in today's time. So first, let's discuss how and why loss of vision or any issues with your vision or your eye can even occur. So the main thing when we're extracting the upper teeth is the use of local anesthesia. The local anesthesia when we extract the upper teeth is injected here, right in the front just below the eye, or at the back in this area of the upper jaw. Both of these areas are areas which are very rich in nerve supply and blood vessel supply to other areas of the face and the orbits. Hence, when we are injecting local anesthesia in these areas, inadvertent injection into the artery, which is the blood vessel right next to this nerve, can lead to backflow of the local anesthetic injection into the main circulation. From the main vessel circulation, this local anesthetic travels directly inside the orbit or sometimes inside the brain, and that is why it can go and affect the nerves which supply the orbit. This can lead to blurring of vision, it can lead to diplopia, partial paralysis of some muscle of the eye. All of these effects related to the local anesthesia backflow are temporary and transient. When the effect of local anesthesia tapers off, so will these effects. The second kind of complication to the orbit, which was more common earlier, is infection of this area, the canine space, due to injection of or extraction of the upper tooth in the period of time where sterilization of instruments, availability of antibiotics as well as delay in infection was very prevalent. Now there are certain teeth of the upper jaw in which the infection spreads very rapidly to this area of the lower eyelid. From the lower eyelid directly the infection gets accessed into the brain, and there can be very serious consequences, one of them being loss of vision. In today's time, patient awareness has increased and patients report to the OPD at the very early start of infection, and nobody allows their infection to reach from the mouth till the eye. Second, compliance of sterilization and disinfection of instruments is quite high in all good centers today, and that is why inadvertent injection of infection into this area has also lowered. And third, availability of wide variety of antibiotics which can be culture and sensitivity proven is also better understood and better available. Hence, overall the chances of having any eye related complications after upper tooth extractions are very rare when done carefully by a trained professional. So please choose wisely. Thank you.